Hello, Dr. Tara.
Good morning, darling. How are you?
I'm doing great. How are you?
I'm excited. We're kicking off season 3 of our podcast, which is amazing, and our guest is amazing. I know you're excited.
I'm very excited. So welcome to season 3 officially. We're so excited to launch and have this person be our season 3 premiere. I found her while scrolling through Instagram because I don't know if you know this, Tara, but I was in a relationship with a narcissist for 9 years and had no idea.
Well, I know. The problem is you didn't know. You didn't know.
I had no idea. I had no idea that I thought a narcissist was somebody that just loved themselves. I didn't know it was a personality disorder. And I didn't know that multiple people would be doing the exact same things. So afterwards, after the relationship was over, I was on Instagram, TikTok, saw all these videos, came across our guest today, and she has some amazing content. And I have so many questions for her. So who do we have?
Well, listeners, get ready. You're in for a treat today. Someone who lives in my world. So I'm really excited. Today in studio, we have Dr. Jaime Zuckerman, who is a licensed clinical psychologist. But not only that, listeners, she is a narcissist abuse expert. She's located in Philadelphia, and she's here today to share all of her wisdom and knowledge with us. Welcome to the Welloff Podcast, Dr. Zuckerman.
Hi, that was such a nice introduction. Thank you. I'm so excited to be here.
Yay. So tell us a little bit about who you are and what you do.
Yeah. So I'm Dr. Jaime Zuckerman. I am a licensed clinical psychologist. I have a private practice outside of Philadelphia, but I also specialize in narcissistic abuse. So I work with people, coaching them through, the early stages, navigating while they're in it, and then helping them once they're on the other side of it, because as we know, the abuse doesn't stop then. So I help them navigate those relationships. And I have a podcast, Next Up Narcissism, where we talk about all things narcissism, have some very cool guests on, and currently finishing a workbook that is based in behavior therapy for how to navigate these relationships.
Wow.
You needed that, Gina. But at least it'll be available to the public. That's a wonderful thing.
Yeah. And that's one of the reasons why we wanted to have you on, because narcissism has been such a buzzword, such a hot topic over the last 3 years. I can't say before the last 3 years. If it was, I didn't know about it. But essentially, we want to kind of bring this subject to light a little bit more, even more than it's been so mainstream now, but to really understand the things to look for, the red flags, and to help people that are currently in relationships now with narcissists and still might not have any idea.
Yeah. I always say this because it happened with ADHD, it happened with OCD. I really dislike when mental health conditions trend.
Right.
Because it does, I guess the benefit of it is that it makes you aware of it. Downside is that it ends up being that a lot of people that have very big platforms talk about this in the wrong way. OCD isn't just being, obsessively neat, right? And ADHD isn't just misplacing things, right? And so narcissism has really kind of exploded in the last couple of years. I think COVID had my opinion on that is I think COVID played a very big role in that, because people were stuck at home with their abusers.
Yes.
And all they had was social media.
I can attest to that.
Yeah. So it's always been there. And, I've always worked with people in that area, but I don't think its presence became as widely known. That's my personal take. I have no evidence to back that up, but that's what I think. And, again, I think it's good because people are learning about it, but a lot of times the word is thrown around for somebody who is just a jerk, or somebody who's full of themselves, or somebody who's self-absorbed, or somebody who is manipulative, but is only manipulative to you for whatever reason. And I'm not saying it's healthy, but they're not like that elsewhere. So, I love that you're talking about this so we can kind of set straight what it is and more importantly, what it isn't.
Mm-hmm. And I agree with you, Dr. Z, because as a fellow psychologist and psychotherapist, one of my biggest pet peeves is when people use diagnoses as adjectives. And secondary to that is when my clients come in and self-diagnose because they saw it on TikTok or they ask ChatGPT, and I'm like, come on now. But so
speaking of ChatGPT, I just wanted to see what would happen. I put in ChatGPT. I just needed to see this. Give me a short-term 2-week behavior plan for depression. Do you know what it spit me out was never did it consider what type of depression, what strategies the person benefited from, what the person was. It took nothing. If I had applied that to any of my patients, no one would have gotten better. So for those of you listening, don't use ChatGPT for the diagnosing stuff.
Yes. Thank you for that. Thank you
Stick
for
to
that.
the real people. Stick to the real people.
Thank you. I needed that validation. But for our listeners' sake, tell us what the myths are and tell us what the actual presentation of narcissism is.
Yeah. So I like that you said presentation because I don't like to use the clinical diagnostic criteria because I think it helps nobody but us. So I like to say what it looks like in real life. So what it's not is not just one thing. It's not just somebody who is self-absorbed. It's not just somebody who is ostentatious and just out there and loud and obnoxious. And I'm not saying this isn't part of it, but those things alone are not it. It's not just somebody that is, selfish and doesn't take you into consideration in certain things. Like they go out to eat with their friends and they don't bring you food home. And that's so selfish. You're so self-centered. You're such a narcissist. No, that's not it. What it is a pervasive style of interacting with the world, interacting with, or how people see you in the world. And it's much larger than just a couple character traits. It is insidious, it's pervasive, it is long-standing. They are this way, not just with certain people in certain situations. They are like this in every domain of their life, even if they are acting very hospitable, let's say very sweet and very nice. That is still part of the narcissistic playbook. So even though they may not be presenting in a negative light, for a narcissist, that's still part of the larger picture. So it's somebody who absolutely lacks accountability for their actions. They will deflect it back onto you. They will blame you. They will deny what they're doing. They will say you're overreacting or you're crazy or I'm not your dad or I'm not your mom. That's not what's happening. They have, I'm not even going to say very little. They don't have empathy for the harm that they cause. They don't have empathy for the impact and the consequences of their behavior. They're extremely manipulative. Yes, they know what they're doing. No, it's not unconscious. It may be habitual because they've been doing it for so long, but when brought to their attention, they will deny it. They won't care. They will reflect it back onto you. And the reason why I say they know what they're doing is because it's not coincidence that the abuse typically occurs in private, behind closed doors. If they didn't have control over it and it wasn't conscious, that would not be the case.
Yeah.
And then the last part is they're very, they can be very grandiose in their ideas, that they're entitled to things without having to work for them or achieve them. They will step on whoever they need to get what they want. Everything is based in their need to gain power and control over you. So if somebody is being a jerk, right? It may be that they're trying to cover their tracks, right? It may be that they don't want you to find something out, right? It's about protecting them. With a narcissist, they don't care. That doesn't matter. What they care about is whatever they need to do to gain power and control over you, to slowly strip you of your autonomy, your sense of identity, your agency, strip you down into nothing so that they can control you. And that's the purpose of all of their behaviors. And they're very hypersensitive to even the slightest bit of even constructive criticism or anything they perceive as criticism.
Oh, yeah, that's for sure. Wait, real quick though. So what you're talking about is basically the definition of gaslighting. So I know that's another huge term. So
people use that wrong too.
Yeah. And on
all the time
on your Instagram, we put in our teaser reel is, the difference between lying and gaslighting.
Yes.
Can you tell us that?
Yeah. So the difference between lying and gaslighting. So gaslighting, love bombing, people they misuse it all the time. So the difference between lying and gaslighting would be if I said to you, if we had plans and you broke plans with me because you said you were sick, but you really went out with somebody else. And let's say one of my friends saw you at the restaurant and they text me and they say, Jamie, I saw them at the restaurant and I know you're supposed to go out with them. Is everything okay? And I contact you and I say, did you go out? Did you lie? And you say no. And I'm like, well, so-and-so saw you out. And I send you the picture they took of you. And you're like, oh, shit, right? Like, all right, now I'm confronted with it. You're confronted with the evidence. You got caught in the lie.
Let's go.
Right? They may blame it on you still, but they're not going to deny it happened. So a lie is to protect themselves out because they're shameful, they feel guilty, whatever. It's about them. Gaslighting has nothing to do with that. Lying is involved in gaslighting, but gaslighting is when they're doing this to make you not trust your own judgment and reality, so that then you need to depend on them to define your reality for them. Because remember, they're also isolating you from people. So you don't have anyone to bounce ideas off of. So you're in this vacuum and they'll say, no, I wasn't out. And you'll show them the picture. That's not me. And you've been through this for so long that what kind of person would actually say that's not me? Well, maybe it is. Maybe it's just someone that looks like you. Maybe it isn't you. And then you start to doubt yourself. Or they'll say, well, your friend just doesn't like me. Maybe, this is an old picture. They could say, yeah, well, I was up, but it's your fault because I don't want to go to dinner with you because all you do is complain. So it's not lying. The purpose of it isn't to get out of something. The purpose is to control you. So that's the difference. The other myth I think is really important, especially for women to hear who are listening, is there's a misconception that narcissists go for people who have low self-esteem, low self-worth, no opinion, no backbone. That is not the case. They gravitate towards people that have empathy because they don't have that. So they want that from you. They want to take it from you. They want to drain you of it. But they go for people who are successful, who are intelligent, who are confident, because it's more stuff to strip away from them. It gives them more supply, more of that reinforcement that they want. What we see at the end of these relationships, or even in the middle of these relationships, is somebody who, through gaslighting and manipulation and control, became somebody who now has very little self-esteem and very little self-worth. They did not start like that. So I want to make that very clear to people that that's not the case. You were tricked into this. It's not because it's not because you couldn't say no to things.
I love that you say that because you're describing me.
Yeah.
And I remember one time, one of my best friends said to me, he dulls your sparkle. And when she said that to me, I still was with him for another 3 years after that. Yeah. But when she said that to me, finally a little light bulb went off in my head. And I was like, oh my God, you're right. You're right.
Yep. Yeah. I just did a podcast with Brittany Cartwright. She said the exact same thing. Dulled my sparkle, and her whole thing is, I'm getting my sparkle back. That's what she says.
Yeah,
and that's exactly
and Gina
right.
has lots of sparkle.
I have lots of sparkle,
and I'm sure that many of our listeners' wheels are turning right now about their own circumstances, relationships that they've observed. So if someone is listening, Dr. Z, and starting to question, hey, that could be me. What are some red flags that we should be looking out for in a relationship? Maybe early signs before it even gets to the point of losing our sparkle or dimming our light for someone else.
Yeah. So the red flags look different, obviously, throughout the course, right? The red flags in the beginning are not what people may think they are. It doesn't look like abuse in the beginning. In fact, you don't even notice it's abuse until way after they've already started abusing you. So the abuse already starts on day one, right? The abuse already starts. They're planting a seed to get you to drop your barriers, drop your boundaries way earlier than you ever would, give them all your vulnerabilities on a silver platter because you trust them, and get sucked into this relationship. So the early stages, red flags. You may be the most wonderful human being in the world, and I'm not doubting that. But if they tell you, I have never felt like this before, I feel like I've known you, we have like our own language, where have you been all my life? You're my soulmate. Like, this is something that is, I've never felt this before. As good as it feels.
And as lovely as it sounds.
As lovely as it sounds. And as wonderful as you may be, they don't even know your middle name, let alone know that you're their soulmate, right? So if you hear, and listen, this is not to make anyone feel, anybody, I look at this preventative medicine. Without knowing this, me, you, anybody is susceptible to this. So it's not because something is deficient in you. It's because they are master manipulators. So, but keep in mind, this is where love bombing people give the wrong language to it. Let's say you're the type of person that drops your boundaries and hands out your vulnerabilities when somebody is not mushy and affectionate with you. Let's say that makes you uncomfortable and more guarded. Narcissist is going to sense that. And so they're going to do whatever it is that they need to do if it means they have to act standoffish because that's what makes you drop your boundaries. So love bombing isn't always what I just said before. It's whatever the person needs to get sucked in, but they give it an excess. The love bombing is the excess part of it. So it's usually what I said, but it doesn't need to be. So it's lavish gifts, it's future faking. So promises. If you're talking about your kids' names on dates 1 through 10, the first 3 months, 4 months, 5 months, if you're talking about your wedding, if you're talking about, moving in together, or they're saying, oh, no, one day you don't need to work. I'll take care of you. Don't even worry about it. Blah, blah, blah. All this kind of stuff when you have this big career, right? Or if you cancel plans with them, and I tell people to do this on purpose if they suspect that they're with somebody that's a narcissist, cancel plans with them last minute and see how they respond. And I always get feedback. That's so rude. You're starting out lying. Great, fine. I don't care. But if they're a narcissist, you'll thank me for it. If you cancel plans with them last minute because you said you're sick, a healthy-minded person is going to say, I'm so sorry. I hope you feel better. I'll check in with you, or we'll reschedule. Text me when you feel better. End of story. Maybe they'll check in the next day. How do you feel? A narcissist is going to either text you nonstop, but in the disguise of they care about you so much, they want to see how you feel. Not that you need to rest, or maybe you don't feel like talking, or whatever the case may be. Or they get pissed at you and they ghost you. You don't hear from them for weeks. Or they show up at your house with soup and flowers, or they send you flowers, like something that is so over the top that is perceived as, I was sick and he drove 30 minutes to my house to deliver soup. Like, who wouldn't want that, right? Mm-hmm. But that alone isn't a red flag, but it's that with all the other things. You talk about yourself and they don't remember anything and they ask you the same question, or you just happen to have the same interest. Like, I love sailing. They've never been sailing in their life, but guess what? Oh my God, I've always wanted to learn how to sail. Will you teach me? Another red flag, if you find yourself talking about your toxic upbringing, your terrible relationship with your father, with your sister, or your ex that you were, traumatized by, if you find yourself talking about those things well before you ever would with anybody else, or telling them more than you even tell your closest friends, that is a red flag.
These are all great. And you
Jamie, where the hell were you 9 years ago? Could have saved me. Jesus Christ. Oh my God.
One of the terms you used, I loved it. Future faking.
Yeah. I can't take credit for that. That's what it's called. But yeah.
Well, that's a new one on me.
Yeah.
But when I am in these circumstances and I'm knowledgeable enough to be dangerous, not an expert in narcissistic abuse.
I love that. I love that. Enough to be dangerous.
Enough to know what I'm talking
She's a little
about.
dangerous. She's a little dangerous.
I love that.
But when I'm speaking to clients about these kind of red flags, what I say is healthy, good relationships start off organically and they progress and they build.
Yes.
You're building something brick by brick. Like you don't come all in all at once. So,
right.
I mean, that I think alone and, like you said, future faking, like talking about your kids' names and stuff like that.
Or
like
promises of engagement, right? Like you move in together and they say, they give you a ring, but then there's no wedding date. Or they say they're going to propose to you, but there's never any ring. So they just kind of keep you on this leash, or they'll take you ring shopping because they want to give you a little bit of hope, but then it never happens. And so the way I describe it the same exact way, that it's not just an instant connection and, I have so much in common with this person. It's more than that. It feels like a tidal wave. And the reason why they sweep you off your feet, there's a reason for that saying, is because they don't want you grounded. Because if you're grounded, then you're going to be able to pick up on these things, or you'll tell other people and they're going to say to you, you know what, that makes no sense whatsoever.
Yeah. So I'm watching my dear friend and partner here have very visible, physical reactions to what you're saying. So for the sake of my girl and for the sake of our listeners, let's talk about how to not feel bad after the fact. Let's talk about don't beat yourself up that you didn't know, because that's what you're left with. It's like an emotional hangover. How could I have been so stupid, which you're not. Yeah. How come I didn't see it? So can we address that?
Yeah. I mean, that's exactly what I went through the past few years is beating myself up like, oh my God, how did I not know? How did I let that happen? Like, and the other thing too is you talk about it as narcissistic abuse. I think a lot of people only think abuse as the physical kind. So
correct.
Yeah.
Yeah. So there's a whole other aspect to narcissistic abuse. So let me try to, it's always hard when you know it clinically, you have to try to explain. So coercive control is somebody's behavior with the sole purpose of obtaining power and control, right? So we see coercively controlling behaviors in sexism, racism, narcissistic abuse. We see it in any area that there is this pull for power and control and behaviors that reinforce that are harmful and manipulate other people, right?
And financial, that's another
Financial. Yep. So coercive control is the hallmark of narcissistic abuse, of financial abuse, of sexual abuse, because it's the function of those behaviors, financial abuse and sexual coercion, all of that is power and control, which is coercive control. So it's all about that. So it's not so much it is narcissistic abuse, but really what you're being controlled by are those coercive behaviors which underlie narcissistic abuse. So here's the thing, the beating yourself up piece, and I also hear from a lot of women too, it's the beating themselves up, it's the coming out of it and having absolutely no idea who they are anymore. I had one client tell me once that she didn't even know what flavor ice cream she liked because she was never allowed to pick what she wanted on her own. She didn't know her taste in music. I mean, it really strips you of who you are. And then lastly, that they wasted years of their life, right? My dearest friend she'll say, I wasted 20 years of my life. Like now I need to restart my career. And so there's a lot of anger. There's a lot of guilt. There's a lot of shame that comes. And you have to remember the narcissist wants that is the intended result of the abuse. So what you're feeling is manufactured, number one. It's there because they wanted it there. And so they crafted everything just so that if you did leave, or even if you didn't leave, you're filled with so much shame, doubt, guilt, all of this. And you're a shell of who you were. That's the goal. So if you feel those things, it's completely valid. It was manufactured. They wanted you to feel this way. They created it. You're carrying their narrative for you, which means you're still kind of taking ownership of the story that they told you about yourself. And so rather than trying to not feel bad, not feel shameful, not feel guilty, you can't get rid of those they're there, right? So what I work with people on is learning strategies to separate yourself from their narrative, to separate the feelings that you have from the manufactured ones, and putting that on the ownership of the narcissist rather than on you.
Yeah.
So how do you help people heal?
So it depends, where I meet them at when I work with them. Either, if I'm helping them, they know something's wrong, but they're not quite sure what. So I help them identify what's going on, name it, help them set boundaries and leave if they need to or they want to, or help them get out, literally like consult with their attorney, help them get out. Mm-hmm. And then post-separation abuse. So as far as a healing process, once you're out of the relationship, work with what I said on kind of separating your narrative from theirs, work on identifying what your values are, reestablishing your values, making sure your behaviors are in line with those values going forward, working with people on how to sit with the discomfort and the, horribleness of what happened. And this is the hard part, I think, for people that were in intimate relationships, is coming to terms with the idea that the relationship you were in, the person you were in, who you saw in the beginning never existed, that this was all a manipulative strategy, that that this idealized version you had of this person that you initially fell for was made up. Mm-hmm. That's really hard for somebody to internalize, and really hard for them to realize that what they just went through was this person was deliberately trying to control and hurt you and didn't care. That is absolute, I don't know if I can curse in here, but that is just an absolute mindfuck. Honestly, I don't know how else to explain it. The whole rug just got pulled out from under you. Your whole world. Forget about even trusting yourself. The thought of even trusting somebody else, that somebody can actually do this, is mind-blowing. And so that, I think, is one of the hardest pieces and is very traumatizing for people to come to grips with.
I think a big part of the healing too is reconnecting to the people that maybe you left by the wayside because this person isolated you, and to be in the fold again of people who love you and are safe and see the sparkle and want you to dial up your light versus dimming it down is a big part of that healing journey.
Yeah. I think, and I completely agree with that. I think in the beginning, the person who has been abused likely believes one of two things: that those people can't be trusted, they're not good for them because they've been conditioned to think that, or that they have so much shame and guilt for isolating them that they assume they're not going to want to hear this because they've heard it before.
Mm-hmm.
Right? Yeah. So there's that too. So one of the things I tell family members and friends of people who are in these types of relationships is never cut ties with them. Even if you don't hear from them, understand it's because there's a lot of control going on. They may not be allowed to, or they may not want to for whatever reasons, but just keep that line of communication always open. Don't get mad at them for disconnecting. Understand the situation they're in for exactly your reason. That one of the biggest strategies, more so than any therapist I think can do, is regaining your social support. And so it really helps when the outsiders don't cut ties with you because you're going to need them. And that's what I tell people, because sometimes it's hard to reconnect when you've been disconnected for so long and you've been convinced that either you're bad or they're bad.
Yeah. So kind of just to segue a little bit, now narcissist is a personality disorder, which is also something that I didn't know. I didn't know that it was like a disorder. Like I thought it was just something that certain people had. But when I started watching these videos and seeing what people were saying and realizing that that was the same exact behavior that I saw and the same things that they said that I saw, talk to us about how it's a personality disorder. And did something have to happen as a child, or like, did they go experience some trauma in order to develop this? What is the story with that?
Yeah. So I think one of the most interesting things about narcissistic personality disorder is that, for depression and anxiety, right? How I manifest anxiety may be different than how you manifest anxiety, right? When I'm anxious, I get headaches, right? My body starts to hurt. For somebody else, they worry. Everybody manifests it differently. With narcissistic personality disorder, it is absolutely wild to me still how the behaviors, as nuanced as they are exactly the same.
Exactly. It's
the same. It's almost as if there's like a little, I always jokingly say, like a little microchip implant. The behaviors are identical for such nuanced, manipulative, under the surface type things. And so there really is this distinct playbook, which is good and bad. Good in the sense of it makes it easier to identify, but bad in the sense of it's hard to identify when you don't know that there's a playbook. Once you know the playbook, you have this aha moment with your clients where now that they see it, they can never unsee it. You can never unsee it once you see it. And so that's why I think there's a benefit. But as far as how people become this way, so narcissistic personality disorder, there are studies that say it's brain related and things like that. But the majority of the research and the majority of the literature out there is going to tell you that it's kind of developmental in the sense that you don't have to be the child of a narcissist, but it is more likely than not that you grew up in an environment that was either extremely chaotic, unpredictable. And so you, as a child, develop these strategies to gain control and figure out your environment as a survival mechanism. Not that children should have to do that, but that's what happens. And they develop these strategies that work great for them, right? While they're growing up, it protects them. It does what it needs to do. But then as you get into adulthood and the context changes, but you continue to apply these strategies and now they no longer work, but you don't change them, you become fixed in them. And, that's kind of how these personality disorders develop. So it could be a toxic environment, unstable environment. It could be unstable in the sense of you were the golden child, you could do no wrong, and your parents never had any consequences for your actions and always went to bat for you and never told you anything. And so you never knew how to even resolve that in your mind. And along with that, they had very high expectations of you that you were not allowed to fail those because you are the perfect child. And so if you didn't perform as you should, then you were either attention and affection and love was withdrawn from you or whatever the case may be. So there's a lot of different variables, but mostly it is developmental for sure.
And
Got it. Thank you.
adaptive.
Yeah.
Yeah. So, I know when I'm in the clinical space, I preach self-care because we can't do this work if we don't recharge our batteries. So how do you stay healthy and well?
Well, that was quite the reaction. Girlfriend's like, I have a cigarette at noon and a scotch at 5. Yes. Okay.
Self-care.
Back to that question.
How do you stay healthy, right?
Yeah. I'm not gonna lie. I mean, it's hard. It's hard. I had kids very late. I have 3 kids. My youngest is 7. I am exhausted. Self-care is schedule related, is making sure I have a schedule, is making sure that I have people that can help me, is making sure that I don't overload myself with things to do, which I'm very guilty of. I have learned to schedule working out or playing tennis into my day as if it was as important as seeing a client.
Mm-hmm.
So I block time out for that. That's super important. I have a really difficult time with sleep. So that's definitely something that I work on constantly.
We need to get you some Sweet Sleep magnesium butter.
Yes.
I don't sleep.
Sleepy Organics.
I'll take it. I have my whole life, horrible sleep.
We'll get you some.
And I'm a big fan of delegating as part of self-care, like delegating tasks at home, things with kids, even little things with work, or just like simple things.
Mm-hmm.
Like, have my son, can you get the mail for me? Like I think that that's super important. So
scheduling time, delegating, all wonderful.
Like
tips.
Time management stuff is self-care for me, but definitely the tennis stuff I have to do for my mental health, because if I do not do that, I'm no use to anyone. I'm a bad mom. I'm just not myself.
As Tara says all the time, you can't pour from an empty cup.
That's right.
No,
that's right.
You can't. So another thing we want to ask you is, on every episode, we ask our guests, what does well off mean to you?
It's a great question. Well off. Well off means to me that you are living a fulfilled life, whatever that looks like for you, that you are living in line with what you wanted, with your values, that you feel fulfilled. And not all the time, right? Because that's life.
Right.
So I think you have to leave. I think well off also means leaving room for and giving yourself, space for things to come up.
Give yourself some grace.
Yes.
Yeah.
You have taught us so much today, and I know our listeners are feeling the same way. So tell us how they can find you, and if someone believes that they are in a relationship like this, what can they do?
Yeah. I'll talk about that one first. So if you're hearing this and you're thinking like, oh my God, this is my life, right? I didn't realize, don't say anything to your significant other. If it's a parent, don't say anything to the parent. You do not want them to know that you're thinking this. You do not want them to know that you're on to this. So, start writing things down if you can safely, because it helps you with the gaslighting to know that what you saw and what you heard was the truth. Start just being very mindful of what things you have access to, like where are your finances? Where are the bills? Whose name are they in? You're going to start to realize things. Patterns are going to start to play out. You're going to start to notice the areas that you never noticed were control, and start to set some boundaries. Get in therapy if you can. You don't have to say it's about this. You could say it's about anxiety, because they're probably already telling you that you have mental health problems. So, kind of get help, get support. Go to the people around you. And if you're looking to leave and you have joint assets or you have a child, consult with an attorney, make sure they understand coercive control, make sure they understand how to be with a narcissist, and they don't just say that you guys need to communicate better, or, a high conflict divorce, it involves 2 people. No, it doesn't. It involves 1. And make sure they understand that. Do not let the narcissist know that you have any plans of leaving, because they'll try to manipulate you back in, or it actually can be, especially when women leave, it's the highest rate for physical violence. And lastly, I will say that it takes on average 7 to 8 times to leave these types of relationships. So if you leave, go back, leave, go back, leave, go back, understand that it's not a setback. It's part of a very long process till
9
when
years,
you actually leave for good.
Process?
Listen, let me tell you something. I tell people I would rather you stay, assuming you're safe, until you're ready to leave, than leave because you think you should, but you know that you're not going to be able to leave for good and come back, because it makes the behavior worse, because you're basically saying, I'm coming back. The narcissist perceives it as, well, you came back, so you're giving me permission.
Right.
Not that that's what you're saying. So, I tell people all the time, you'll leave when you're ready. The worst thing I think is trying to force people to leave when they are not, forget psychologically ready, but financially ready. They have support. They have a place to stay.
Mhm.
I mean, there's so many variables. So there's a lot involved. Where they can find me, you can find me on Instagram, Dr. Z Psychologist. My website's drjamiezuckerman.com. My practice is Z Group Therapy, and we can see people in different states depending where you are for everything, not just this, but anxiety, depression, stress. And then my podcast is Next Up Narcissism, and you can find that wherever you listen.
So great. Thank you so much, Dr.
Thank
Jamie
you, guys.
Zuckerman.
Yes,
You're
thank
amazing.
you. This
Thank
was
you
very
guys for having
enlightening.
me. Good.
And,
I'm
and if
glad.
we can help one person get out of a bad relationship, we did our job.
Yeah.
That's
Thank you
right.
guys for having me. And thanks for talking about this.
And thanks for opening up our season 3.